Hello, and welcome to the training on self-directed services available in the Intellectual Disability and Living at Home waivers. This is the fourth video in a series of 7. In today's presentation, we will discuss what the Intellectual Disability, or ID, and Living at Home, or LAH, waivers are and what self-directed services are available in the waivers. We will also go through services that are available but can't be self-directed. The ID and LAH waivers provide services to anyone 3 years and older with an intellectual disability. The ID LAH waivers offer services and supports to help people live in the community. The ID LAH waivers provide many services that support the participant. These include personal care, respite, adult companion services, assistive technology services, environmental accessibility adaptations, individual directed goods and services, personal emergency response system, skilled nursing, and specialized medical supplies. Let's go over these services in a little more detail. First, we will look at personal care. This service covers activities of daily living, or ADLs. These are supports that are necessary to assist people with basic physical needs, including eating, bathing, toileting, dressing, and grooming. Another covered service in personal care is instrumental activities of daily living, or IADLs. These are tasks such as cooking, cleaning, and grocery shopping. Legally responsible individuals or legal guardians cannot provide personal care. Next, we have respite. Respite is a service that provides the unpaid primary caregiver a break. This is usually planned in advance. Legally responsible individuals and legal guardians cannot provide this service. Next is adult companion services. Adult companion services are non-medical care with supervision and socialization. This service provides the adult participant an opportunity to participate in community events with family or friends while getting support from a worker. Legally responsible individuals and relatives cannot provide this service. Next is assistive technology services. Assistive technology services directly assist an individual in selecting, getting, or using assistive technology, including specialized durable medical equipment or any equipment not covered by the Medicaid state plan services, a service animal, or a system or item that will help the participant increase, maintain, or improve their abilities. The next service is environmental accessibility adaptations. An accessible home is a necessity. With environmental accessibility adaptations, the participant can make necessary changes or adaptations to their home. These items must be part of the participant's plan and must be necessary to ensure the participant's health, welfare, and safety, or help the participant function with more independence in the home. The adaptations must be something that will ensure the participant will stay living independently instead of requiring institutional care. Legally responsible individuals, relatives, and legal guardians cannot provide this service. Next, we will go over individual directed goods and services. Individual directed goods and services are things that support the participant to be more independent at home or in the community. The item or service addresses an identified need in the plan and is not otherwise available through the Medicaid state plan. Another important thing to consider for goods and services is that they are only for participants who are self-directing their services and can save funds to pay for them. The support coordinator will assist the participant to ensure each of these requirements are addressed and met. Additional things to know about individual directed goods and services include that individual directed goods and services doesn't cover experimental or prohibited treatments. A participant may not use individual directed goods or services to pay for rent or mortgage payments or food. Individual directed goods and services also cannot be used to pay for items that are solely for entertainment or recreation. Individual directed goods and services cannot be used to pay for things that are illegal or otherwise prohibited by federal rules, state statutes, and regulations. If the participant doesn't have the funds, the item or service cannot be purchased. And finally, the participant and service coordinator must make sure the item or service is not available through another source. Legally responsible individuals or legal guardians cannot be a provider of individual directed goods and services. As with any of the services on the IDLAH waivers, your support coordinator can guide you and provide you more information. Another service on the IDLAH waivers is a personal emergency response system, often referred to as a PERS. This service is used when there is a need for the participant to get help in the event there is a physical, emotional, or environmental emergency. A participant can purchase cell phone service when the traditional PERS is not available or possible. The IDLAH waivers can pay for the installation fee, the monthly fee, upkeep of the system, and maintenance of the device or system. Other things to consider when purchasing a PERS system include the installation and testing fee cannot be more than $500. The monthly service fee cannot be more than $83 per month. The cost of the system cannot be more than $1,500 per month, and the maximum cost per year for the PERS cannot be more than $3,000. The next self-directed service is skilled nursing. Skilled nursing covers training and supervision for the worker related to medical care and/or medication assistance and nursing procedures that meet the participant's health needs as ordered by a physician. Legally responsible individuals, relatives, and legal guardians cannot provide this service. And finally, we're going to talk about specialized medical supplies. The specialized medical supplies that are covered will be identified in the plan and address the participant's physical health and/or be necessary to maintain the participant's health, safety, and welfare. The specialized medical supplies need to increase the participant's ability to perform activities of daily living and/or prevent further deterioration of a condition. Also note that participants must use an approved ADMA MH vendor for the specialized medical supplies. This service cannot be performed by legally responsible individuals, relatives, or legal guardians. Now that you know the services that can be self-directed, let's look at the services in the IDLAH waivers that are available that cannot be self-directed. They include rehabilitation services, employment services, pre-vocational services, assistance in community integration, benefits and career counseling, crisis intervention, housing stabilization services, occupational therapy, physical therapy, positive behavior supports, remote supports, speech and language therapy, employment, supported employment, and transportation. Thank you for listening to this training on self-directed services in the IDLAH waiver programs.